I recommend for patients that are afflicted with hyperhidrosis as far as alternative treatments or conservative treatments to try first before even considering undergoing the endoscopic sympathectomy or ETS would be a topical agent such as Drysol. It is applied on the skin of the afflicted or affected area. The most common side effect of that is a rash or irritation of the skin. But that's one. Another would be an oral medication that has an anticholinergic property, meaning it inhibits or impairs sweating. There are many different medications that do have these properties. What I commonly recommend to try first would be Ditropan, which is like oxybutynin is a generic name. Robenol is another, but that's another option to try. Botox injections, actually for certain areas such as the palm or the underarm, works really well. It doesn't work well for the face or the scalp. There's too much area. And unless you treat the entire area, then the non-treated areas will just run down or drip over treated areas. So I find, and have found over the last several years, that patients that have spent the money and undergone the time of having Botox injected in either the scalp or the forehead, it doesn't work well. But it does work for most, not all, but for most patients, well for like the palms and the underarms for a period of about usually 3 to 6 months. Some patients report to me that it works well in controlling and stopping or lessening their sweating for a little longer, maybe up to 9 months or so. On the other hand, there are a few, not many, but a few patients that tell me that it didn't work or it hardly even made a difference in their severe sweating. But that's uncommon. Most likely, the Botox injections would work well for a period of about 3 to 6 months. Then there's ionophoresis, where you put your palm in solution, run an electric current through it. That is another option. It's called, one particular brand is called Dryonics device, but ionophoresis is another particular more conservative treatment option to try. And then, of course, diet modification. Avoid caffeine, different spicy foods, and other foods that may, in fact, trigger sweating. The topical, which 10-20% of patients, from what I've seen over the years, find, hey, it works well. The oral medication, similar, 10, 20, maybe 30% of patients say, yeah, it works well in controlling my severe or moderate symptoms. It actually tends to work better if the severity of the sweating, of the hyperhidrosis, is more mild. In patients that have the severe form, where it's just dripping and runs down the wrist and things like that, or down the face, I find it doesn't usually work well enough at all. Herbal remedies, some patients have reported to me that different herbs may be of minor benefit, but manipulation of the spine, chiropractic manipulation, or acupuncture, some of these other alternative treatments. What my experience in talking with patients that have had these types of treatments done is it doesn't help at all. Psychotherapy, behavior modification, actually that may help to some degree. I've seen some patients where in fact it did help to lessen the severe form of the sweating condition, but it doesn't stop it. And it's not like they're overly anxious and that's the cause. It's the over anxiousness, so to speak, or the anxiety actually is exacerbated or triggered by the underlying condition of the hyperhidrosis, not the other way around. Treatment options for, say, severe armpit or underarm sweating would be either Botox injections every, say, 6 months or so, or some people try liposuction. The problem with liposuction is that's not where the sweat glands are. They're mostly in the dermis, and it tends to come back. SDLA for subdermal laser ablation specifically targets the sweat glands in the dermis, and that is one much more effective option. I find that the ETS or micro-ETS stops the hands sweating, makes the hands warmer, like if you suffer not necessarily from sweating of the hands, but Raynaud's or severe episodes of severe cold hands or fingers. Works really well for that if done at that level. And facial blushing that's triggered by emotions or anxiousness or anticipation, facial sweating, scalp sweating. These areas it works really, really well if done at the right level. It doesn't work as well, say, for the underarms. The underarms is about a 50, maybe 75% somewhere in that range, chance that it'll stop the sweating. On, again, about half the patients that I've done this on for underarm, after the fact, tell me, well, the underarms is still a problem. And so it doesn't work nearly as well for the underarms. Even if you include several levels of T2, T3, T4, I find the underarms, the efficacy or the chance of improvement is not as great. And for the feet, it doesn't really, there's about a 50-50 or 50% chance to actually that the feet sweating will lessen in a response to, say, the palms becoming dry. But that would be through an indirect mechanism. So in one sentence, ETS is most effective for palmar sweating, hand or finger Raynaud's or coldness of the fingers, facial or head sweating, facial and scalp sweating, and facial blushing triggered by anxiousness or anticipation.